Anonymous, why the thumbnail? Are you trying to make me fail No Nut November? I think I know what No Nut November is. Now, are you doing that for a cause? Because then I'll support you. But if you're just doing No Nut November to prove something to yourself, that's cool. Hope you're not in a relationship because that's gonna be rough. I will say, doing a simple task that you can stick to, for example, like brushing your teeth with the opposite hand that you're used to, proving it to yourself that you can be strict and disciplined and stick to it can actually translate to other areas of your life. And then you'll start seeing your ability to be disciplined in going to the gym and following a diet. Maybe No Nut November is exactly what the doctor ordered. I know that sounded weird. I'm a triplet. Have you ever delivered multiples? Any stories? Courtney, I've never delivered triplets. I've never even delivered twins. Although my sister has twins, they're my nephews, and I play with them all the time. Does wearing glasses make your eyesight worse? No, Gabrielle, that's like a common myth that you hear from people. I think the misconception started off when someone uses eyeglasses, or let's say not using eyeglasses, and they think their vision's fine. They put on eyeglasses, everything seems like it's HD and amazing, and they take the glasses off and all of a sudden it looks worse. That's because you now got used to seeing normally with the glasses. Acid. What are the current opinions on tattoos in medical school? I have a sleeve on my left arm, but everything can be covered. Would this be an issue? I don't think it's an issue, especially right now. Medical school is becoming incredibly progressive. I have a tattoo. It's not shown. It's obviously coverable. That's ideal just because all humans have their own implicit biases. We undergo some implicit bias training to be more aware of them, but they exist. So why create an opportunity for a tattoo on your neck or on your face that patients are going to have to confront that and deal with it? You're bringing another barrier into the doctor-patient relationship. And I'm not saying that they're right for doing that, but it's gonna happen. If you're aware of that and you understand the consequences, by all means, get that tattoo. I'm a fan. And send me a picture of it because I want to see. Civil duckling 4N. I don't know what 4N means, but I like you, civil duckling. Is it weird to sneeze 7 times in a row? Is it weird? Weird meaning unusual? Yes, it's unusual, but most people do sneeze in multiples. And my buddy, Leonard Sherman, aka the sausage maker, he sneezes like 7, 8, 9, 10 times in a row. He literally sounds like a dog. He's like, chit, 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 chit. Cora Mitchell, should I take prenatal vitamins if I'm trying to get pregnant? Yeah, Cora, you really should. Within prenatal vitamins, you have a nutrient called folate or folic acid you'll see sometimes. That's really important for the development of your child's neurological development. I generally don't like supplements, and I tell people all the time that, you shouldn't really be taking a multivitamin unless there's a medical reason for it. Trying to make a baby and conceive, you should be taking prenatal vitamins. That's a medical reason. There is proof, there is research on that, so I do recommend prenatals. Can you please do a collab with David Dobrik or another YouTuber who you haven't collabed with? Natalie, I want to do this so bad. I do have one collab lined up with a very popular YouTuber. I've already collabed with Ricky Dillon, Ava Gutowski, and Gabby Hanna. But if you have a YouTuber you want me to collab with, my biggest piece of advice, because I don't necessarily feel comfortable just going out and saying like, hey, collab with me. They get so many requests as is, I don't want to be annoyance. If you want to tweet at them or leave comments on their YouTube videos that you think they should collab with me, I'll jump in, I'll retweet your tweet, I'll comment, perhaps we can get a line of conversation going. Kristen Musa, what are your opinions on routine infant circumcision in the US? I don't know how routine it is. I guess that you do have to sort of deny it if you don't want it to happen. I don't think that there's a lot of great evidence to support routine circumcision. I think it's a surgery, it has risks, it has benefits, and it should be up to the parents to make a decision on what they want to happen to their child. What I do when I'm functioning as a pediatrician, as a family medicine doctor, I have a detailed discussion with my parents. When I say parents, I mean my patients who are parents. There's not a lot of great benefits. We're seeing some decreases in what we call balanitis, which is inflammation of the glands of the penis. There's been some research on showing decreased transmission of HIV in those who are circumcised. It's not evidence that's mind-blowing or even life-changing. There's certainly side effects if the procedure goes wrong. And it can go wrong. Things can go wrong in these procedures. I've seen botched circumcisions. Just think about how bad that is. I don't think it's mutilation. I've heard some people discuss that because there are some benefits, but it's just important to weigh those benefits versus the harms for each individual patient and not just make this a routine procedure. What are your thoughts on anesthesia awareness? Is it possible to wake up during surgery? Evie, I've heard of this. It's really scary. I can't imagine if I'm cut open and then I wake up and I feel everything. I've heard of instances of this happening, knowing how true it is because it is subjective. It's hard to know. I believe all my patients. It's really scary and something that scares me, and I've thought about this. What if the anesthesia, since part of anesthesia is amnesia, meaning that you forget what happened also, what if during your surgery you wake up, or you don't wake up, but you feel everything, but then when the surgery is over and you wake up from the anesthesia, you have amnesia, so you don't remember the surgery. Squid lava. Why do I have such a short attention span? Maybe because you're a squid lava. I don't know. I need to ask you so many questions. The fact that you asked this one question without any punctuation in the YouTube section tells me that you definitely have a short attention span. My thing is, when someone comes in with a complaint of short attention spans, I don't like jumping to a disorder, because what that does is that encourages you to label yourself as a person who has, let's say, ADHD. It now becomes a self-fulfilling prophecy that's gonna keep you from reaching your goals. I instead like to focus on what are your symptoms, what can we do to help them, what can we try from the most conservative to then an increasing stepwise approach. That's my thought process on it. I hope you were able to, despite your short attention span, listen to my blabbing. I like your logic. I like your logic, Nachachana, because you left that quote in order to give me a compliment because you knew I'll use it in this video so that you'll get airtime. So well done. I like your logic. Before I take a test, I study and know most of the information, but while I'm taking one, I seem to blank out. What causes this? Can I fix it? Mark, this does happen. This has happened to me. I mean, I've taken hundreds, if not thousands of tests in my career in trying to become a doctor. Something that you may be doing that could be contributing to this is not simulating a testing environment. I'll explain what I mean. I'd like for you to set up with a timer, however long you need for your test. Give yourself a test. Don't know the answers, practice recalling that information. Recalling that information is a different type of memory, and you need to practice that. Can we please see pictures of teenage Dr. Mike? Amy, dear, you don't want to see it. You don't want to see it. Spiky, Jersey Shore, Pauly D hair, in your face, obnoxious. Look, teenage years are awkward years. It's not easy to get through them without some embarrassing pictures floating to the surface. What's your take on birth control for teens to use to regulate periods? Taya, sometimes this makes sense. I know a lot of people worry about taking birth control, about increases in risks of certain cancers. And while there's some truth to that, there's also some decreases in cancer rates when taking birth control. So it's always a trade-off between the benefits and the harms, especially when you're talking about hormonal treatments. I have used birth control in teens to help regulate periods. That was a treatment that I've done in the past. Is it right for everybody? Absolutely not. It's an individual decision that you should make as a team with your doctor, and if you're a teen, with your parent. I can pop my big toes multiple times in a row. You should put that on your resume. It's awesome. Dr. Mike, can you make a video about concussions? More information needs to be known about this injury. I agree with you. In fact, 2 days ago, I was playing basketball with my nephew. I snuff him because I'm the block master. No.
Not in my house.
I fell, and I fell so bad that I actually have a bruise on my hip, bruise on my shoulder. My head got rattled a little bit, and I think I had a mild concussion because I had a headache for like 3 days after that. I was initially going to specialize in sports medicine after my family medicine residency. I've attended the conferences on concussions. I've looked at the research on this, so I will be making a dedicated video just for you. What is an unhealthy amount of time on your phone a day for your eyes or your brain? I know it's not your specialty, just curious on what you thought. Robert, I'm curious whose specialty you think it is to talk about cell phones. I'll tell you what I tell parents of teenage children and I guess middle school children. It's to limit screen time to 2 hours a day outside of what you get in school. What we found is not causation, but a correlation, which means two events happening simultaneously. Those who spend more than 2 hours of screen time a day have side effects as a result. Struggles with mental health, some visual issues. Try and limit it to 2 hours a day. Live in real life. Spend time laughing with your friends, doing stuff outside. The world is beautiful, and God, I sound like I'm 90 years old. 2 hours, that's your answer. Just found your videos and I'm obsessed. I don't think it's healthy. Guess what? On the contrary, it is healthy. You're watching a doctor break up misinformation, teach you real stuff about your health, give you some guidance, allow you to have fun, get your neurotransmitters going. Win, 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 win. But please don't spend 500 hours a day watching my videos. You see, that was a trick statement because there's not 500 hours in a day. I was exaggerating, and you know that because you're educated. If radiation can cause cancer, how come doctors use it to try and shrink the cancer cell? Radiation is lethal to cells. Now, cancer cells are cells too. So if we can target the radiation very accurately, and now we have amazing technology courtesy of radiation specialists, physics specialists, when you can target radiation at the tumor cell, you can actually kill those cancer cells. Van Halter, is it normal for me to be able to touch my head to my butt? Okay, I'm not flexible, so I can't do it. You could be hypermobile. I have patients with hypermobile joints. Well, that could be a sign of a clinical condition like Marfan's or some other ones. What I know about people who are hypermobile is they're more susceptible to injuries. You're supposed to have a limited range of motion, and when you go past that physiologic range of motion, you could actually cause damage. Talk to your doctor about what you can be doing and where you have to exercise caution. What do you give first, good news or bad news? Cameron, when I receive news, I want to hear the bad news first, because I'll take that shock and then hopefully the good news will make me feel better and I'll forget all about the shock. When I'm delivering the news, I think I like to do the same thing. Making people wait for bad news can increase the anxiety related to that bad news, therefore making the person more susceptible to negative effects. That's my medical way of thinking about it. I saw my first mental health professional today. Can we talk about how weird it is to talk about inner feelings with a total stranger? Stephanie, you're 100% right. It's hard to talk to a complete stranger. It takes time to build a rapport, and we're not gonna give you a diagnosis and a treatment plan right away from the first visit. It takes time for you to be able to share things, create a connection, make sure to stay positive, carry a personal sense of responsibility, and know that there is no obstacle that is too big for you to overcome. If you come with that mindset, you will do better with your outcomes. As always, stay happy and healthy.